Vitamin B6 is not a stimulator you feel like caffeine. It is a quiet cofactor family, especially pyridoxal phosphate, that helps more than 100 enzyme reactions involved mainly in amino acid metabolism. If those reactions stall from true shortage, nerves, blood cells, immune defenses, and mood chemistry can look off. If status is already adequate, stacking another daily pill rarely upgrades the pathway.
Okay, then why do so many B6 videos jump straight to 9 big benefits and talk as if a daily capsule is an automatic upgrade? If this is mostly behind-the-scenes enzyme help, what should viewers distrust first?
Wellness marketing loves B6 for mood, nerves, energy, and hair-adjacent claims. Distrust the automatic upgrade first. The mechanism can sound impressive enough that people skip the harder question. Is this correcting a shortage or just adding more cofactor to a pathway that was already stocked? If you cannot name the shortage, the upgrade story is probably advertising, not physiology. Think of B6 as workshop tools for amino acid chemistry. Pyridoxal phosphate helps convert, strip, or rebuild amino acids used to make neurotransmitters such as serotonin, dopamine, and GABA. That is a real physiologic job, and it helps explain why frank deficiency can disturb nerve and mood pathways. It does not mean doubling the tablet doubles calm, focus, or nerve comfort when your enzymes already have enough cofactor on board from food or a modest multi. Exposure pathway matters just as much as the enzyme story. Food B6 arrives with protein-rich meals, and ordinary multivitamin amounts usually stay near physiologic need. Concentrated pyridoxine tablets can deliver many times that need day after day. Same vitamin name, very different dose pressure on sensory nerves over months. Human milk research also shows B6 levels vary by maternal diet and region. Another reminder that intake context is not one universal pill number for every body or every life stage. So who is actually short? Classic low B6 can show up with dermatitis, glossitis-type mouth changes, microcytic anemia, depression or confusion, and weaker immune function. Those signs are a reason to think about status, medications, and diet quality with a clinician, not a free coupon for megadosing everyone who feels tired on a Thursday afternoon.
That helps, but is low B6 mainly a rare textbook problem? Or are there real groups where checking status makes more sense than buying a wellness bottle off a thumbnail promising overnight nerve repair?
One concrete signal comes from a 2026 systematic review in Mexican children and adolescents. Overweight and obesity were linked more often with several micronutrient shortfalls, including vitamin B6 alongside zinc, iron, and vitamin D. That is association, not proof that every adult with weight concerns needs a B6 megadose. It does show deficiency risk can travel with diet quality and metabolic context, so assessment beats guessing from a podcast.
Before we chase heart or brain claims, can we put the toxicity line on the table? People treat water-soluble vitamins like they cannot hurt you. Is B6 actually one of the supplements where long-term high doses can injure nerves?
Yes, high intakes from food have not been reported to cause this problem, but chronic high supplemental intakes can cause severe progressive sensory neuropathy with tingling, numbness, or poor balance. It can appear at doses some users do not recognize as extreme, especially when a B-complex, energy blend, and separate B6 tablets stack together for months. Food almost never creates that exposure story. Concentrated pills do. Now, the heart marker story. B6 is often bundled with folate and B12 because the trio can lower homocysteine, a blood marker linked with vascular risk in observational work. Marketers love that lab drop. Clinically, you still have to ask whether fewer heart attacks or cardiovascular deaths follow the prettier number, or whether the chemistry improved while the hard outcomes barely moved.
So if the combo lowers homocysteine, are we supposed to treat that as a heart protection win? Or is this another case where the blood marker moves and the outcome scoreboard barely budges?
In a coronary disease meta-analysis of over 14,000 participants, folic acid plus B-complex vitamins lowered serum homocysteine by about 2.4 micromoles and reduced vascular restenosis risk. But major cardiovascular events and cardiovascular mortality did not significantly improve. Useful chemistry, incomplete clinical promise. Broader vitamin supplement prevention reviews have often been similarly cautious on hard outcomes. There are narrower lanes where measured B6 still earns attention. Network evidence on nausea and vomiting in pregnancy includes vitamin B6 among interventions that may ease symptoms, ideally under clinician guidance rather than self-stacked megadoses. In IBD remission, B vitamins plus magnesium improved fatigue and ulcerative colitis symptom scores over 4 weeks, though effects on underlying inflammation stayed uncertain. And a recovery trial used about 19 milligrams of pyridoxine with nicotinamide after hard eccentric exercise to raise muscle stem cell activity markers in young men. Interesting, specific, not a forever wellness template.
What about the bottle itself? If someone already takes medicines, has a chronic illness, or is heading into a procedure, how careful do they need to be with an extra B6 or B-complex on top of food?
Judging benefit means picking the right scoreboard. If the issue was documented low status or clear deficiency features, watch those features and follow up labs under clinical care. If the goal was brain fog, remember network analyses show B6 with folate and B12 often improve blood markers such as homocysteine, while cognitive gains are domain-specific and far from universal. A prettier homocysteine slip is not proof your thinking got sharper. So the fair close is simple. Vitamin B6 is essential amino acid and neurotransmitter chemistry. Correct real shortage. Respect a few supervised lanes, such as clinician-guided pregnancy nausea care. Treat chronic high-dose daily pills as a sensory nerve risk rather than a lifestyle upgrade. If tingling, numbness, or balance changes show up after months of supplements, that is a stop-and-call moment, not a cue to add another B-complex.